Good morning, everyone. So, the story started last year when I was attending this debate with the participation of our colleague, Dr. Cristiano Irale. And the debate was about performance for elite athletes, the high performance. And yes, you see this right. He was able to say something between four ladies. So he took the chance. And when he did that, he asked a very good question to the audience. He asked one important question. And he said, how many of you believes that mental preparation is no less important than physical preparation for high elite athletes? And I was sitting there and I saw it in my eyes. That was very much evidence based. I saw almost all of hands were raised. And then he followed it with another question and said, okay, in this case, how much we do about this in terms of mental preparation, if we know that or if we agree that it's really no less important than physical preparation. Okay, so Cristiano actually has never failed to influence me, but this time I went so far and started a master degree, as Dr. Lewis said, in sports psychology, and in hope I can find an answer to his question and also to find common areas between sports medicine and sports psychology. Actually, I should charge you, Cristiano, for my master fees. So let me introduce, by the way, this guy in the photo. Not too far from Italy, another Italian gentleman, Roberto Baggio. He was the Italian's sweetheart in the 90s, played for Italy national team and many Italian clubs. Well, actually, Roberto Baggio was exceptionally good, and he won the Ballon d'Or in 1993, and he was the happiest probably at that year. But unfortunately, happy moments unfortunately do not last long. And 1 year only after this, he missed a vital penalty kick against Brazil in the FIFA World Cup final in Los Angeles 1994. And since this moment, this picture became actually viral, and it became the most probably historical photo, one of the most historical photos in the football, and he was called at that time the man who died standing. Probably, I think you recognize this photo now. Yes, this is true. So, the question now, what does it mean when a leading sports medicine hospital like Aspetar welcome athletes with this photo? What could be the message behind this? There should be a message, of course. And I think the message is in the same line with the new IOC action plan statement, which says athletes' mental health needs are as important for their performance and well-being as their physical health needs. And that good mental health means much more than absence of mental health symptoms or disorders. This was from the new IOC mental health action plan. So, but before we think again of Dr. Cristiano's question about how much we do, let's ask another question. How much we know in this regard? Well, we absolutely don't know everything, but for sure, we know one thing at least, that the relation between mental health, performance, and injury is actually complicated. And injury can potentially unmask or trigger mental health disorders. On the other hand, there may be mental health disorders that increase the likelihood of or complete or complicated or complicate recovery from injury. And we also know that we should not only treat the body. I like this photo or this phrase by Michael Jordan when he says when he got injured, and he says, my body could stand the crutches, but my mind could not stand the sideline. And actually, this is very touching in my opinion, because when the players walk out of our clinic with an unpleasant diagnosis and we call the next patient, we don't know maybe that there is another journey starting behind the clinic room, a journey of struggle and stress with these athletes. And stress is one of the biggest enemies of athletes' well-being, of course, as this meta-analysis shows that high stress responses and history of negative stressors had the strongest association with injury rates. And let's have a look how athletes respond to injuries and how each of these responses work according to this systematic review. So 3 things mainly happens: cognition, response, emotions, and behaviors. Well, cognitive response, this means that first responsibility starts from the clinic, actually, when we deliver the news, where we give the diagnosis of the injury. And I'm sure Di Maria in this photo, he's receiving the best explanation, no doubt. A good understanding of injury nature can significantly prevent further consequences, such as emotional response or negative emotional response, which may as well affect the athlete's behavior response, like motivation, goal settings, compliance with the treatment, as well as response to treatment, which is very important. It's important to know that each injury has avoidable and unavoidable consequences, so we know where to fight and where to work on. Unavoidable consequences include pain, functional disability, time loss, and moving away from competition. Whilst avoidable consequences include anxiety, depression, loss of confidence, and fear of relapse. So this also brings back a paper published by our previous colleague Claire Ardern, when she found that physical recovery alone is not enough to ensure return to sport after ACL reconstruction. Claire found that 1 in 3 athletes does not return to pre-injury level of sports after ACL reconstruction, and there are modifiable and non-modifiable factors may influence return to sport. So these modifiable factors, for example, concluded that lower fear of re-injury, greater psychological readiness, more positive subjective assessment of knee function, versus the non-modifiable factors such as female, older age, non-elite athletes, the higher risk of non-returning to the pre-injury sports level, and these things that we cannot do much about it. And before we move on, there is one point was raised by sports psychologists, which is there any advantages at all in injuries, or they are all bad? Maybe yes, maybe we can use the chance of the injury occurrence to help the athlete to look at their self and to maybe find more in their social life, non-sport interests, personal strength and self-limits, enhancing knowledge about body health and prevention, and also to work on mental strength and self-recognition skills. And I like also this, said by Conor McGregor, an injury is not just a process of recovery, it's a process of discovery. Well, now we can go back to Dr. Cristiano's question and find out how much we can do and how can we support injured athletes within our clinical practice. Starting from prevention. So few intervention models were developed, and one of the most popular ones is Williams and Anderson stress and injury model. It's also worth mentioning a study done on 32 football players with risk psychological profiles divided into two groups. One of them applied 6 mental skills for 19 weeks and sustained only 3 injuries across 3 players, comparing to 21 injuries across 13 players in a control group. So this maybe brings some evidence that implementing psychological prevention programs can really help in this regard. Screening also. We do screening here in Aspetar, and we know that it's a very essential part of our practice. And in screening, it found that some psychological variables are associated with higher injury risk. And we'll go through them in the next slides one by one, but mainly personality, confidence level, motivation, anxiety, and stress. Starting with personality and risk injury. So there are different personalities, of course, not only in athletes, all of us, and there are some also works done on each type of personality, and found that, for example, high neuroticism, low self-esteem, low emotional stability, low self-control, and high impulsivity, those are higher risk of injuries and slower recovery. And there are several personality screening tools are published to determine this. And confidence also, confidence and risk of injury. Confidence is highly related and clear. It has a very clear impact when it comes to performance, but actually it's different when it comes to injury. It's not very clear if it's increasing the risk of injury or lowering it, so there are like different studies about this. Motivation, maybe surprisingly, high motivated athletes are more prone to injuries. There are some explanation to this, because motivated athletes, they are willing to compete, and when maybe at increased risk of injury even. This motivation may lead athletes to ignore their body's warning signals and continue playing or training despite being tired or injured. Interventions, there are some interventions likely to modify motivation and goals can be effective in preventing injury in athletes who have a high level of motivation and set challenges goals. For example, interventions that promote the adoption of more realistic goals and the reduction of excessive motivation have been found to be effective in reducing the risk of injuries in these athletes. Also, anxiety is a very big topic as a risk factor, and we know that certain levels of anxiety are normal in sport. Of course, this is a normal response when we are facing some kind of pressure, but higher level of anxiety are also associated with increased risk of injury. And anxiety can cause psychological changes that increase muscle tension and decrease attention and concentration, which may increase the likelihood of injury. In addition, anxious athletes may make less effective decisions during competition, which may also contribute to being more easily injured. and also can be a reason for indirect injuries such as stress fractures and eating disorders. Oh, this is actually one of the very complicated topics, which is how anxiety works. But I like it, and I'll try to go through it quickly. There is what the phenomena which called the shocking under pressure or the mental block, and this happens when athletes are facing a high pressure competitive situations. So in these cases, our brains works in two different ways, different processing systems. System one, intuitive, characterized as fast, automatic, based on intuition and emotion, and this is usually used in normal cases. But when we are facing high pressure situation, our brains move to system two, which is reflective, slow, and requiring cognitive control based on the use of rules. And in sport, in low pressure, again, we use the system one. But what happens when we are facing a high pressure that we allow the athlete to perform their skills smoothly, usually? What happens that the things that we do without even thinking about it too much, it's like by default. So we start to think about it very carefully and to do it probably in a way that it's called overthinking or like over focusing on it. And this can lead to a lot of anxiety and can make us more prone to injuries. And I think this is a situation we face in our lives. I feel it in myself. I hope I'm not alone in this. Like when we think too much of routine things that we do, we usually don't do it correctly. So stress again is the biggest enemy. Probably there is not enough time maybe to go through in details because it's a very complicated model. The biopsychosocial model is also very commonly used one by sports psychologists, and just wanted to show only this one, and this identify the stress factors, risk factors of stress, and also identify prevention methods, which is again the biopsychosocial model. Just to let you know that there are some works done on this and to analyze the stress and also to suggest ways of dealing with it. Not to forget also to mention or to highlight this important topic, which is the athlete-coach relationship and its impact on injury risk. It's been studied a lot, like how the bad or good relationship between the athlete and the coach can really play a role in this field. And I remember also an international athlete I see in the clinic one day when he was struggling with a prolonged injury, overload injury, and in the end he mentioned to me that once he was injured, he was completely ignored by his coach and he was immediately out of his plans. He doesn't know anything about the team, what they are doing, what they are planning for. So he struggled a lot and he started to develop a lot of stress and anxiety, and he couldn't cope at all with the injury, which was not really actually physically severe. So it's important to know this thing, especially for whom among us who work as team physicians. We need to keep this in mind and to talk probably to both athletes and coaches about it. Well, so what are the psychological interventions in recovery process? There are a lot, or let's say many of them, and what are the objectives, why we use them? As you see, they can help in acceptance of the injury first of all, then coping with the injury, then pain management, emotional support, adherence to rehab, and then readiness to return to play, which is something very important that we discussed in an earlier slide of that study after ACL reconstruction. And one of them is the goal setting, very effective technique. to define realistic short, medium, and long-term goals to promote commitment and to involve also athlete in decision making. This makes things really more realistic, and when we help athletes to divide the rehabilitation, for example, into some shorter stages, and they feel the achievement every time they reach something like improve the pain score, the range of motion, then they feel that they are going on the right path instead of just waiting for the final result, which is return to play or return to sport. Then self-talk. This also can help with eliminating negative thoughts and promoting positive thoughts, increasing self-confidence, which is very good for reducing the risk of injuries, reducing anxiety, increasing motivation, and increasing the speed of recovery. Okay, visualization, or what's called imagery or mental rehearsal. This is one of my favorites, and this is very powerful tool, described as magic by some sports psychologists, they told me. It works really amazing. And it's frequently seen in competitions before performing, if you might see this before, especially for these athletes who perform like a quick and short actions or movements such as diving, or before kicking a penalty kick, they close their eyes and they think, they rehearse mentally the movement before they actually do it. And in rehabilitation, it plays a big role. According to some studies, it showed like a really effective impact on pain management that can reduce the perception of pain and discomfort by focusing the mind away from the sensation of pain. Also in healing, visualizing the healing process can enhance recovery by simulating brain areas involved in motor control and sensory processing, which may promote quicker tissue repair and reduce recovery time. And finally, but last but not least, there are a lot of studied effects of visualization, muscle activation, that some studied, not probably in a very high quality, but showed that visualization itself can help in muscle growth and muscle activation. Yeah, so there are a lot of things, and I think it's even to relieve the stress, which is something, it's visualization is not meditation, it's something different, but also it helps in the same way that meditation can help, in addition to the psychological effects and physical effects maybe that can be done with visualization. And I cannot finish this before highlighting the importance of sleep. Just imagine how much efficient quality sleep can help in recovery, and how poor sleep can delay the recovery. I think you are all familiar with this, and we have enough evidence showed that good enough sleep can help in repairing and regeneration tissues, help in fighting inflammation, in pain management, in cognitive and mood effects. Okay, going back to Roberto Baggio, where we started. In the end, what I'm trying to say from this is that sports injuries are multifactorial and cannot be managed based on a single factor only, which might be physical factor for us. Stress factors, for example, fractures are highly related to increased load, as we know, and lack of nutrients. But underlying causes for poor nutrition can be eating disorders, for example, which is psychological, which needs psychological support, not only physical support. Same in pain management. When we face challenges in reducing the pain in the long term, this might be related to sleeping disorders, because we knew from previous studies that good enough sleep can help in reducing the pain or increasing the tolerance of the pain. So also one thing like we screen for vitamin D, for example, a lot. Like we focus, we concentrate on this, and it's very important for us to see like what are the levels of the lipids or vitamin D, which is of course very correct. But are we really screening in the same way for stress factors, and which is, if not more important or contributing to injuries, at least it's at the same level of importance, in my opinion. So in the end, there is a big room for sports psychology implementation in our sports medicine practice. It can be implemented in prevention, screening, and clearly explained diagnosis when given to patients. Psychological interventions during rehab, as we saw in previous slides. Return to play criteria, psychological readiness, and this can lead us to think of what we can do in this, how we can implement sport psychology in our practice, maybe by making some sport psychology multidisciplinary interest groups. We can talk about it, we can discuss, we can implement it in our researches. And here we shouldn't also forget that we have a great and amazing sports psychologist colleagues working with us in Aspetar. So they are very helpful, and they do a lot of fantastic work that we don't even know about it sometimes. We don't know a lot. So this is also an invitation for everyone to explore this, to talk to them, to work with them. We are not sports psychologists, but we cannot ignore the role of sports psychology in our sports medicine. And we have the experts in this. And finally, I would like to say something like, please, every time you deal with an athlete, when you deal with the management of an injury or a case, keep in mind that psychological intervention can really help. And also, every time you see Roberto Baggio standing on Aspetar wall, think of the message behind this and why he's standing there first of all. So in the end, I would like to thank you all, but special thanks also to Dr. Karim Khaladi for his for sharing knowledge with me and introducing a lot of amazing things about sports psychology, and his sports psychology team all. And also special thanks to Dr. Luis and Dr. Paul Dextra for supporting me in this topic. And finally to Dr. Cristiano Irali for inspiring me in this. And you still have to pay for my master, Cristiano. Thank you all.